my dear friends. A beautiful day outside, it's a little bit on the windy side, but that's good. Stimulates our mitochondria. You know, the mitochondria I spoke about before, it's actually a bacteria that we parasitize. Yes, we are parasites. So scary to think about that. Yeah, in a way we're enslaving the mitochondria because it gives us something, but then again we give it something else. So I guess maybe we're a symbiotic relationship, although it doesn't really need us. No, although we do supply it with a host, it could survive without us, although it has gone into the human kingdom and the animal kingdom. But the mitochondria is a bacteria, has its own DNA, and it's found practically in every cell. Only cell, if I remember correctly, it's not found in is the red blood cell. I know it's not found there, but I think every other cell it is found in. And what it does, its function is to produce energy for us, ATP, that we can utilize. And it's actually the one that uses the oxygen. We're unable to use the oxygen to utilize it in order to provide energy. We have a little pit stop over here. And the same idea I've been speaking for quite a while. It was 2012 when I was talking about it, that it's important to have our intestinal flora, the bacteria that we have inside, help us as well. It supports our mood because it's responsible for the stuff in our gut, starting from everywhere. I mean, you know, I remember doing the test when I was a resident at Columbia, inside the mouth. So starting from the mouth, where we have healthy bacteria, and sometimes you have overgrowth of unhealthy bacteria. You see that people's tongue looks black when they take antibiotics sometimes, or you can see thrush, overgrown of Candida, but they really are there all the time, the bacteria. It's just that when that delicate balance is broken for a variety of reasons. And that brings me to a lady that I saw recently, and I called my staff because I like to teach them. You walk into the room and right away you smell there is a strange smell. And that smell is actually a nice, fruity type of smell. And that smell of ketones. So usually you are taught that this is seen in diabetic ketoacidosis. But this was not a diabetic patient at all. What this lovely lady had is she had Whipple bypass surgery, which means they removed the head of the pancreas and removed part of the small intestine. And that was because they, by mistake, did a CAT scan and found that there is something that could be cancerous. The reason I'm saying it is that she was losing some enzymes, and that good morning, and that delicate loss of balance led to the change in the type of the flora that she has and the smell that you can see, you can feel. And this is something that we don't take enough don't pay enough attention to, and it's something that is responsible for a lot of our health. So now we're talking about the gut flora and the immunity and how it relates when we are treating our patients. And it is very important that we are realizing it, better late than never. The reason I'm saying it is it was laughed at for quite a while, and I often like to tell you stories about how doctors laughed about ideas, and some of my ideas they laughed at, some of them or they still laugh at. That doesn't mean that it makes it right, my ideas, but you know, you don't want to just laugh about it because you're the only one who is saying it, or you're one of you who are trying to talk about that, and then you realize that you missed out the boat and you didn't help enough people. I mean, if you're looking at now at the treatment for melanoma, for example, they laughed at that guy who was talking about the melanoma treatment, and now it's saving lives. Before, if you caught it and it was not in sight and there was a positive lymph nodes, I mean, they tried gazillion things, it didn't work, and now they're using this treatment for so many cancers, you know, retraining your immune system, retraining your T cells. So those therapies, and he was available doing it here in the United States, in Texas. He was just for over 20 years before they finally kind of listened to him. So anyway, gut flora is finally talked by Haberman and other scientists. It's really a key that you should look into much more. And that's it. We're gonna have to go on our run now. It is a bit cold if you don't move, so enjoy the weather. Good morning. Enjoy the nice weather outside. You can see the beautiful sunrise in the background. Yes, and you can see it's very few people out here. And we're gonna go for our run. Have a beautiful day, everybody.